you can start the recording. Okay, Assalamu alaikum everyone. I'm Yazan Almasry and I'm very excited to give this PAL session. This is my first PAL session. Inshallah, it's one of many in the future. So I sent you guys a survey. I don't know if you didn't see it on the community group WhatsApp thing. Okay, and you guys requested two main things. You requested the knee and anastomosis. Okay. Now for anastomosis, I already did a recording. Yani, I'm gonna send the YouTube link inshallah to you guys. I recorded the lower limb anastomosis and I drew them for you guys and I hope you understand and yani, benefit from them. I'm even gonna send you a version where I explain it in the PowerPoint, you know? Okay, and for the knee, for the knee, someone else is going to explain them. I think they already explained it in the clinical anatomy, and my friend Amr, he will do the review session for the questions, and inshallah, he's going to be explaining them. So I didn't want to explain them again, just to not repeat anything. Okay, so just to get started, okay, I'm a third year, okay, and I'm very excited to do this. I already said this. If you have any questions at any point, if there is any concept that you didn't get, I'm here all night. Let me know anything. I don't mind explaining like over 40 times, okay? Okay, so let's get started, okay? So before we get started, I want to explain a couple of concepts, okay? So what are these concepts? The first concept is related to this, okay? So now, whenever we have a tear ligament, okay, or a torn ligament, we have to understand that it happens because the ligament is overstretched. So what do I mean by that? I mean that, let's say, for example, we have, this is the knee, okay, so this is the lateral side, and this is the medial side, okay. So in the knee, what happens is that whenever we have a force that's applied from here, okay, so what's gonna happen is that the ligament is gonna be stretched from here, okay. So when we apply a lateral force from the lateral side, you would think that maybe, okay, we're applying to the lateral side, the lateral ligament will be torn, but no, that's not the case. Why is that? Because this ligament will be pushed and it will be overstretched. And whenever we have overstretching of the ligament, we can tear it. Okay, does that make sense?
Yes.
Okay, perfect. Does anyone want me to repeat?
Can you repeat, please?
Okay, so whenever we have a ligament, the way that the ligament gets torn is that it's getting overstretched. Okay, so you can see this ligament, for example, or this ligament. Okay, so if it's overstretched, so it's getting stretched to the point that it cannot take it anymore, then it will be torn. Okay, so let's say they tell you, for example, someone was okay standing and there was a lateral force applied to their knee, which is coming from here. Okay, so what's going to happen is going to push the knee this way and this way, okay, and it's going to stretch the ligament so much, and then once you stretch this ligament, it's going to keep stretching until it tears. Okay, does that make sense?
Yes.
Okay, perfect. And the same exact thing goes for the ankle joint. So we have two movements in the ankle joint, inversion and eversion. I'm going to explain them and how you can remember them later, but just for the sake of the concept, when you have, for example, this action is called inversion, okay? So when you have inversion, what's happening is that you're stretching out this side, okay? So you're stretching out this side so much to the point that it cannot take it anymore and it gets torn. So when we have inversion, for example, hyperinversion, what's going to happen is that this is the lateral side, so the lateral ligament will be overstretched and it's going to get torn. Does that make sense? This is the same exact concept at this one, but this one is with the foot, with the ankle joint. Does that make sense?
Yes.
Okay, perfect. And this is the same thing with the hypereversion. You're going to overstretch the medial ligament because you literally do it when you do hypereversion, and you're going to tear it apart. Okay, so this is the first concept. Is everyone clear on this? Should I move on?
Yes.
Yeah,
Okay.
it's clear.
Okay, so let's solve this question since it's clear. Okay, so a football player was hit on the lateral side of the knee. Okay, a doctor placed his hand on the medial side of the thigh. He's pushing this way, and he puts his knee on this side. Okay, and he's pushing this way. So which ligament is he testing for? Okay, so if you have your answer,
medial collateral.
Okay, medial collateral, perfect. Okay, can you explain to us, Fawaz, why is it medial collateral?
I just know that when the lateral side of the knee is hit, medial collateral ligament is damaged.
Mm-hmm. And I just explained that concept. Why is the medial side hit? Okay, sorry, why is the medial ligament and it's affected? Because when you push from the lateral side, so this is the lateral side, when you push from the lateral side, what's going to happen is that the medial ligament is going to get overstretched. and it's going to keep stretching to the point that I can't take it anymore, and it's going to be torn. Does that make sense, guys?
Yeah, it does.
Yes, it does.
Okay, perfect. So this is the first concept that I want you to understand before going into the lecture. The second concept, which is not related to this lecture, but I just wanted to clarify it for anastomosis. Okay, and I even clarified it again for the recording, but just for the sake of completeness. Okay, so what is this? Okay, so this is basically an anastomosis that happens at the back of the thigh. Okay, why is anastomosis so important, and why does Dr. Atif keep talking about anastomosis? And he's like, anastomosis is very important because let's say the femoral artery is broken, or not broken, sorry, it's blocked here. So what's going to happen is that usually the blood would go from here and would go down here and would keep continuing. But since it's blocked, you cannot do that. So what's going to happen is that it's going to go from here and it's going to take the collateral pathway, and then it's going to go away like this. So the main keyword I want you guys to keep in mind, and this might come in an MCQ or an SAQ or an OSPI, just remember this. If they ask you, why do you need anastomosis? The key word here is collateral circulation, excuse me. Okay, collateral circulation. Keep this in mind, please. Does that make sense?
Yes.
Perfect. Okay, so these are the first two concepts. If you get it, I can get started with the lecture. So is it clear? Okay, I guess it's clear.
Yes.
No. Yes, perfect. Okay.
Could you repeat it again? Sorry.
So this collateral circulation, of course. Okay, or the first concept, which one?
The collateral.
Okay, so let me erase this. Okay. Okay, so let's say the femoral artery is blocked here. Okay, normally the blood flow is going to go this way, and then it would go. But since it's blocked, it's not going to be able to go this way, right? It's not going to be able to. It's just blocked. Okay, so what happens is that since we have anastomosis, so this anastomosis is going to be like a rescue. So the blood will actually just go from here into here, and then go this way, and then go back into the femoral artery. So it just bypasses it. So this is like a bypass, okay, to the block. This is why anastomosis is important. Anastomosis, maybe I should have started explaining it. Anastomosis is basically two arteries joining together, okay? So for example, in this case, we have the popliteal artery is joining with the femoral artery. How is it joining? Through these anastomosis. Does that make sense?
Yes, it does make sense.
Okay, perfect. So now let's start with the lecture. Okay, so Bismillah ar-Rahman ar-Rahim. Okay, so these are, okay, so this is, this may be overwhelming. The slide is very compact, for no reason. Literally, this is so simple. Okay, so what do we need to take from this slide? Okay, so the first thing is that, remember in the hand, we had carpals. In the foot, we have tarsals. Literally, that's the only difference, for the names, okay? So we're gonna start, okay, so these are all the tarsal bones. Okay, these are the metatarsals, and these are the phalanges. Okay, so this is how the bones are. So we have tarsal bones, metatarsals, and we have phalanges. Okay, now between the tarsals, between these tarsals and these tarsals, we have something called transverse tarsal joint. Why is it called transverse tarsal joint? Because it's between the tarsals. Okay. Now, between the tarsal bones and the metatarsal, we have a joint that's called tarso-metatarsal joint. Now, whenever we have a joint in MSK or anything in general, just break it down. So tarso, which is referring to tarsal, and metatarsal. So it's a joining between tarsals and metatarsal. So it's called tarso-metatarsal joint. Does that make sense? Okay. And the last one, or the last two actually, there is metatarsophalangeal joint, which is between the metatarsal and the phalanges. Okay, so here metatarsals and phalange. Okay, and then you have interphalangeal joint. Interphalangeal joint means between the phalanges. So it's going to be here, it's going to be here, it's going to be here, it's going to be here. All of these. Does that make sense?
Yes.
Yeah, it does.
Okay. Okay, so that's what you should get from this slide. So what you should get from this slide, if they ask you, for example, in an SAQ, wallah, someone is whatever, and they're gonna bring a long scenario, and then the stupid question is gonna be, for example, which of the following or mention the joints of the foot? You're gonna be like the transverse tarsal joint, the tarso-metatarsal joint, the metatarsophalangeal joint, and the interphalangeal joint. They might ask you to mention 2, they might ask you to mention 1, they might just bring you an MCQ, and you just keep them in mind, okay? You don't need to memorize them by heart, you just need to understand how they work, because between the tarsals, we have a joint, between the tarsal and metatarsals, we have a joint, between the metatarsals and phalanges, we have a joint, and between the phalanges themselves, we have a joint, okay? Now, another thing that you need from this slide is to memorize the name of the bones. Okay, so how do we memorize the name of the bone? We have a mnemonic. Okay, so what is the name of or what's the mnemonic? It's very dumb, but yeah, and you have to memorize it this way, honestly, and it's the mnemonic, okay? So it's tall camels never consume cubes. Okay, so tall for talus, okay? Camels for calcaneus, okay, calcaneus, I'm sorry. And never for navicular, consume for cuneiform, and cubes for cuboid. Okay, so let's repeat it again. Tall camels never consume cubes. Tall for talus, camels for calcaneus, never for navicular, consume for cuneiform, cubes for cuboid. Okay, now there's 3 different bones for cuneiform. You just need to know that there's medial, intermediate, and lateral. That's it. Yani, just memorize the name of the bones. Yani, probably you won't be asked about it, but if they say, for example, which of the following is a tarsal bone, you'll be able to remember it through the tall camels never consume cubes. Does that make sense? Honestly, I find it easier to remember it with a mnemonic, yani. Okay, so now this, okay, oh my God, this is probably going to be very overwhelming for you guys, and you guys are already overwhelmed, and it's a lot of things, okay? But it's completely fine, it's understandable to be overwhelmed by this, but this is very easy, and I'm going to make it easier, inshallah. Okay, so what do you need from this slide? Okay, so first of all, what are we looking at? We're looking at the dorsal view of the foot, okay? And what you need to understand from this slide is this. The rule of 2s. I made this rule, so don't Google it because there is no such a thing, okay? So before we get into the rule of 2, to remember that the rule of 2s is for the dorsal view, just remember 2D, like this slide. This slide is literally 2D. Just remember that it's 2D, so it's the rule of 2s is for the dorsal view, okay? So what is the rule of 2s? Okay, so we have 2 main arteries. What are these 2 main arteries? We have the anterior tibial artery and the dorsal pedis artery. So these are the 2 main arteries, okay? Now, dorsalis pedis is a continuation of the anterior tibial artery. So it's not a different artery, it's just a continuation. But just to make the rule easier, just remember the 2 main arteries, anterior tibial and dorsalis pedis. Okay. So that's the first thing. Okay, so 2 main arteries is dorsalis pedis and anterior tibial. 2 branches from anterior tibial. So what are the 2 branches? We have the medial tarsal artery and the lateral tarsal artery. These are the 2 main branches from the anterior tibial artery. Okay, then we have 2 main branches from dorsalis pedis, which are the arcuate artery, as well as the deep plantar artery, okay? And then you have 2 main joint arteries. So what do you mean by 2 main joint arteries? 2 arteries that are joining together. Okay, so what are these arteries? As you can see here, the arcuate artery is joining with the lateral tarsal. So these 2 are the first, okay? So this is the first joining. And the second joining here is the deep plantar artery joining with the deep plantar arch. Now, we're going to discuss what's the deep plantar arch in the next slide, inshallah. So just keep in mind, okay, we have 2 main joint arteries, the arcuate with the lateral tarsal, and the main one, and the most important one. And if you're going to remember one of these 2, just remember the deep plantar artery joining with the deep plantar arch, okay? And then we have 2 nerves. Simple. We have the deep peroneal nerve. Okay, where is it? It's here. Deep peroneal nerve and superficial peroneal nerve. So just to recap, we have 2 main arteries. This is for the, first of all, this is for the dorsal view of the foot. We have 2 main arteries. We have the anterior tibial artery with the dorsalis pedis, okay? We have 2 main branches of the anterior tibial, which is the medial and the lateral tarsal arteries. We have 2 main branches from dorsalis pedis, which is the arcuate artery, as well as the deep plantar artery. We have 2 main joint arteries, which are the lateral tarsal with the arcuate artery. And we have also the deep plantar artery joining with the deep plantar arch. And lastly, we have two main nerves, which is the deep peroneal nerve with the superficial peroneal nerve. Is that everything we need to know from this slide? No, there is just one more little thing. Okay, so what is this little thing? Is that, okay, we talked about what's it called? Deep peroneal nerve as well as superficial peroneal nerve will supply the foot. Okay, there is a specific area that is only supplied by the deep peroneal nerve. So what is this specific area? This is the area between the large toe and the small toe. Okay, this area is known as the web skin between the first two toes. Okay, why is this important? Okay, I even circled it for you guys. Okay, why is this important? Because the case scenario is going to tell you, for example, someone is, for example, he was pricked with a needle in this area. Okay, so if he was pricked in a needle in this area, which nerve is responsible for this sensation? And the question might be easy, and they will just bring either deep peroneal or superficial peroneal, and you will choose either. Okay, I mean, it's deep peroneal and they won't bring superficial peroneal. However, there might be a trick. They might tell you, for example, in the choices, there will be deep peroneal and superficial peroneal. The answer will always be deep peroneal, okay? So if they tell you, again, if they tell you which is the supply between the, in the web skin between the two first toes, it's going to be, the answer is going to be deep peroneal. They probably won't tell you this in this way. They're going to tell you someone who got a nail stuck in this area or someone who got pricked in that area or anything, okay? So let's recap together. What's the rule of twos? Okay, so again, just to recap everything, to stick it to your memory. Okay, so we have two main arteries, anterior tibial artery, dorsalis pedis artery. That's the first two. Okay, then we have two main branches from anterior tibial, medial tarsal and lateral tarsal. That's the second two. The third two is we have two branches from dorsalis pedis, the arcuate artery and the deep plantar artery. Okay, then we have two main joint artery. What are these two main joint arteries? We have the deep plantar artery joining, which is the most important thing, joining with the deep plantar arch, and the second one, the arcuate artery joining with the lateral tarsal artery. Okay, and two main nerves, the deep peroneal nerve and the superficial peroneal nerve. Okay, the important thing to take from this slide is the rule of twos. Okay, and to keep in mind that deep peroneal nerve will supply this area. Okay, now if they ask you, for example, the middle toe or like the third toe is affected, then it's the superficial peroneal. Deep peroneal is only this area when it comes to toes. Now, they're not going to ask you about this area or this area or this area. If they ask you about this area, this area, for example, it's deep peroneal, but they probably won't ask you. They will only ask you about either this area or this area to trick you. Okay, so if they ask you about this area, this is superficial peroneal. If they ask you about this area, this is deep peroneal. Does that make sense to everyone? So we can move on.
Yes, it does. Thank you.
Okay. If someone doesn't get it, like, let me know because I can't. Someone's saying, can you repeat? So which one do you want me to repeat? I'm not, I'm sorry, I read it late. So if you can either send in the chat or unmute, please. Rule of twos. Okay, I'll repeat it one more time. Okay, so first of all, we have the rule of twos. Okay, how do you remember that the rule of two related to the dorsal view of the foot? Okay, how do you remember? By just remembering that's 2D. Yani 2D is a view. Just remember it this way, and stick it to your memory. The rule of two is to dorsal view. Okay, so what is the rule of two? That we're gonna have multiple things that are two. Okay, so the first two things, we're gonna have the anterior tibial artery. The main two arteries first, sorry, excuse me. So we're going to have two main arteries in the dorsal view of the foot. What are they? We're going to have anterior tibial artery as well as dorsalis pedis. These are the first two. Then we have two branches of the anterior tibial, which are the medial. So let's check it. Okay. Then we have the medial tarsal artery and the lateral tarsal artery. These are the two main branches of the anterior tibial. Okay. Then we have the two main branches of dorsalis pedis, which are the arcuate artery and the deep plantar artery. Okay. Then we have the two main joint artery, which is, this is the main one, first of all. Try to remember this as much as possible. Okay, deep plantar artery joining with the deep plantar arch. Okay, and the second one, lateral tarsal artery with the arcuate artery. Okay, and two main nerves. We have the deep peroneal nerve and the superficial peroneal nerve. Okay, did you understand? Or okay, perfect. Thank you. Okay, so we can move on to the. It's not working. Wait. We can move on to the plantar view of the foot. Okay, so this plantar view of the foot is much simpler. Honestly, it's very simple, inshallah, and you guys are going to get it really easily. Okay, so plantar foot of view, how to remember and know the main artery supplying the plantar part of the foot is posterior tibial. You remember P with P. Okay, so P with P. Okay, so posterior tibial and with plantar view. Okay, so this is how you try to remember it. Okay, so this is the artery responsible for it, and since it's posterior tibial, it's with the tibial nerve. Okay, but I don't want you to think of it this way, because also here it's anterior tibial. You might think it's a tibial nerve, but no, because of the rule of the twos, we have two nerves. We have the deep peroneal and superficial peroneal nerve. Okay, so we have the posterior tibial artery with the tibial nerve. These are the major blood supply and nerve supply. Okay, now what do I need to remember from all of this arteries and anastomosis, and oh my God, there are so many things. Okay, so let's take it step by step. So we have the posterior tibial artery. Okay, it's going here, then it's going to divide. Okay, it's going to divide. It's going to give two branches. It's going to give lateral plantar artery and the medial plantar artery, which is the same as tarsal, but instead of tarsal, it's plantar because it's the plantar view of the foot. Okay, and the nerve is going to do the same thing: lateral plantar nerve and the medial plantar nerve. Okay, does that make sense? I hope so. Okay, now the concept that is really important in this slide that I emphasized a lot on in the last slide is that the lateral plantar artery is going to continue to form the deep plantar arch. And do you remember what does the deep plantar arch join with in the dorsal view? I hope someone remember, please. Deep plantar arch is going to join with what?
Deep plantar artery.
Perfect. Yes, deep plantar artery. Okay. Since most of you hesitated, I'm going to go back to the other slide. Here it is. Okay. Deep plantar artery will join with the deep plantar arch. So what it means is that from dorsalis pedis, we have this deep plantar artery here going down. This is the deep plantar artery. Okay, it's going down here, and it's going to go join here. It's going to this is where it's going down, and it's going to join with what? It's going to join with the deep plantar arch, which is this thing. Does that make sense? Here it is.
Yeah.
I even written it here for you guys. Okay, so from this slide, what do we need to remember? We need to remember that the deep plantar artery will join with the deep plantar arch. Where's the deep plantar arch coming from? It's coming from the lateral plantar artery, which is also coming from the posterior tibial artery. So we also need to remember that the dorsum of the foot is supplied by tibial nerve, and also the artery is supplying it is posterior tibial artery. Why is this important to understand? Okay, excuse me. Okay, this is important to understand because let's say, for example, you got a question. Someone, wallah, was walking and by mistake he stumped on stumped. Yeah, I think that's the word. Stumped on a pin or a nail. Okay, so which artery is supplying the dorsum of the? And they're going to ask you, for example, which artery is supplying the plantar view or the plantar side of the foot? So what do you guys answer? Deep plantar, posterior tibial. Okay, so perfect. It's posterior tibial. Now, you guys are all correct. However, okay, there's no however. Actually, you're all correct, and it's perfect. You guys all got it right. Okay. Now, they might do a trick, okay? So they might bring you a question, and you're going to be like, okay, so there is a question, wallah, and someone stepped on a nail, but posterior tibial is none of the answer. So what is the second answer that you would choose? Is deep plantar arch or, deep plantar arch. There's no or. Okay, so they will either bring deep plantar arch or posterior tibial. I hope they don't bring both because I don't know what you would choose if they bring both, but if they bring either deep plantar arch or posterior tibial, choose either of them, okay? They're not going to bring them together. Inshallah, they won't bring them together. Okay? I hope this all makes sense. So again, just to recap from this slide, we need to know that the plantar view of the plantar side of the foot is supplied the posterior tibial artery and the tibial nerve. And even they will bring you a question, for example, wallah, someone stepped on a nail and he's feeling pain. What's the nerve that's supplying the plantar side of the foot? I just said it. Tibial nerve. Okay, perfect. Okay, so that's the two main nerve and blood supply. Okay, or one main actually. And this is the anastomosis that you have to memorize. Okay, why is it important to memorize? Because it's connecting above the foot, which is the dorsum of the foot, with below the foot, which is the plantar of the foot. So it's like a connection. So whenever the plantar arch is going to bleed, it's going to have a lot of blood because it's two major arteries. It's the posterior tibial and the dorsalis pedis. You see where's the connection? It's going to be a lot of blood that's coming out. This is why it's important to understand. Okay, does that make sense? So I'll repeat the last concept that I just said. Okay, you have the connection between dorsalis pedis and the posterior tibial. Okay, it's connected by the deep plantar artery with the deep plantar arch. Okay, and this is important. Why? Because when someone steps on this side, okay, for example, stumps on a nail, what's going to happen is that there will be a lot of bleeding because this is connecting between not only posterior tibial but also dorsalis pedis. So you're going to have a lot of blood coming through. Does that make sense?
Yes.
Okay, perfect. Oh, my pen is gone. Okay. And I hope you all like find it easy now. Okay, so this slide. Okay, so this is the medial view. Okay, you probably don't need to know anything from here except two things. Okay, so what are these two things? Okay, so first thing, okay, usually in clinic we take pulses. Okay, why do we take pulses? Let's say for example someone wallah is coming with a shock, which means his heart is not pumping enough. Okay, when his heart is not pumping enough, how do we know it's not pumping enough? One of the signs that we know is that we go check distal pulses. Okay, one of the most distal pulse in the body is dorsalis pedis. So for example, okay, so you don't need to know all of this. I'm just explaining so you guys get entertained and understand it and stick it to your memory, okay? If someone comes to a clinic and he's having a shock and so on, okay, the way you would know he's having shock, you would test for dorsalis pedis and you would see that there is an absent or really reduced pulse, okay? This you would know that his heart, wallah, is not pumping blood. It's not reaching the end of the foot, okay? So dorsalis pedis, you'll be able to take the pulse here, okay? And you have another pulse, which is the posterior tibial, okay? Which you can take posterior to the medial malleolus. So what's the medial malleolus? If you look down at your ankle, you will see a bony prominence. Behind this bony prominence is literally the medial malleolus. Behind this bony prominence, you're going to feel the posterior tibial pulse. Okay, so I want you guys to actually feel this right now. So I'll give you like a minute or two just to feel the pulse. Okay. If you guys felt it, let me know as well. Oh, someone felt it. That's great. It's very. What if we are bad in? It's completely fine if you're bad in palpating it. Yeah, I personally cannot palpate it, and I'm third year. It's fine. But it's fine. Even if you don't feel a pulse, it's okay. You're good. Don't worry. Okay. So, do you guys get this? So from this slide, you need to understand the most distal pulse in the body is what? Dorsalis pedis. Okay. And you can feel the posterior tibial pulse where? Right behind the medial malleolus. Okay. Understood? And here is a picture how you take the pulse. The medial malleolus will be here and it's going to be prominent. You're going to know it. Just behind it, you're going to feel this pulse. Okay. And here's the dorsalis pedis. Okay. And you're going to feel the pulsation after you put your hand. And this is very interesting because you guys haven't started pro. Pro is like a clinical skill. You're going to start in second semester, inshallah. And you're going to be doing all of this stuff. It's going to be very interesting. Okay. Now moving on. Before I move on, everything is clear with the artery and nerve, or should I repeat anything?
I think it's always clear.
Alhamdulillah. Okay. Now, okay, so this is an important concept. Okay, now in the ankle, this is going to sound weird, but in the ankle, we have two joints. We have the ankle joint and the subtalar joint. Why is this important? Because a question might come, for example, to you, and someone is going to be like, for example, someone cannot evert his foot, okay? Which joint is affected? And you're going to be like, the ankle joint. This is incorrect. It's not the ankle joint. The ankle joint is only responsible for plantar flexion and dorsiflexion. So this is plantar flexion, okay? Sorry, this is dorsiflexion. You're going up with the dorsum, and plantar flexion. So how do we remember it's plantar flexion? This one is plantar flexion, this one is dorsiflexion. I always, they gave us this in pre-med, and it's so funny. Plantar flexion, you imagine like you're stepping on a flower. I don't know why, but plant, flower, okay. Plantar flexion, you're stepping on a flower. And the other one is the opposite one. Okay, so this is the ankle joint. So the ankle joint is responsible for two movements only: plantar flexion and dorsiflexion. Okay, if they ask what is responsible for eversion and inversion, you say subtalar joint. It's two distinct things. Don't, please do not confuse them with each other. Subtalar joint is for eversion and inversion, and the ankle joint is for dorsiflexion and plantar flexion. Okay, does that make sense?
Yes. Yes.
Okay, now how do you remember this is eversion from inversion? Okay, eversion, the dorsum of the foot is going to face inward. So yeah, you're putting your feet's going to be inward, facing inward. This is the foot. This is the sorry, not the dorsum. Sorry, I confused you all. The sole of the foot, or the plantar of the foot, okay, is going to face inward. Okay, so the sole of the foot, when you invert, it's going to face inward. Inversion, inward. Does that make sense?
Yes.
Okay, perfect. So this is the subtalar joint, and this slide was at the end, but I decided to bring it here since we're already talking about subtalar and the ankle joint. So the ankle joint, plantar flexion, dorsiflexion. Remember this. Eversion, inversion. Which joint? It's the subtalar joint. Okay. Now, the subtalar joint, from its name, subtalar, below the talus or the talar. Talus is the bone. Okay, one of the tarsal bones that we talked about. So subtalar, below the talus, we have articulation with multiple bones, or we have connection with the talus bone with multiple bones. Okay, so what are these bones? We have the calcaneus and navicular. Okay, and we have two articulation. We have anterior articulation and posterior articulation. Okay, so the posterior articulation will be only between calcaneus and talus. So if we try to join the words together, we're going to get the word talocalcanean joint, and this is the posterior articulation. The anterior articulation will be between this is the calcaneus, still between the calcaneus plus the navicular plus the talus. So we're going to make a really long word, which is the talocalcaneonavicular. It's a whole sentence, but in the exam, if you get stuck, how do you remember? Okay, so the main one is, first of all, the main joint. Okay, the one that's on the top is what's it called? Talus. So talo will be always in first. Okay, so we have talocalcaneal and we have talocalcaneonavicular. So the second most important one is calcaneus. Okay, so it's going to be talocalcaneal always. And then we're going to add navicular at the end only if it's anterior articulation. Do you need to know which one is which and if it's anterior or posterior articulation? Honestly, I don't think so, but I'm just explaining in case. Okay, so in case you're asked what is the anterior articulation, you would say talocalcaneonavicular joint. If you're asked what is the posterior articulation, you would say it's the talocalcanean, and that's it. There is no navicular and posterior. Okay. Type. What is the subtalar joint responsible for?
Eversion and inversion.
Okay. What is the ankle joint responsible for?
Dorsiflexion and plantar flexion.
Okay, perfect. Someone is asking me to repeat. Okay, so subtalar joint, subtalar means this is the talus. Okay, this is a very weird talus. Anyways, below it. So below it, subtalar. So the joint is going to be between the talus and two different points. Okay, you're going to have the calcaneus, and you're going to have one more point, bone, which is the navicular. This is anterior, and this is posterior. Now, in the posterior articulation, which is here, this is talus, calcaneus, this is navicular. In the posterior articulation, it's just between the talus and the calcaneus. So you make the word talocalcaneal. Between the and the anterior articulation, you have three bones. You have the talus, calcaneus, and navicular. So it would make talocalcaneus, and it's very long, navicular. Do you get the point? 2-1-2-2-1-5-3-8-3-9. Do you get the point? Okay, perfect. Are you guys like forced to join by your ID? You can't put your names or something. It's funny.
Yeah, they asked us to do that for attendance.
I think I even have that. It's for all of us. Okay, so I hope this is clear. Okay. Oh my God, I skipped. Okay, so subtalar joint, inversion, eversion. Ankle joint, dorsiflexion, plantar flexion. Commit that to memory, please. In the exam, if someone puts ankle joint for eversion and inversion, I'll be really, really sad because I emphasize this so much. Okay? Now we can have a break for 5 minutes. Or do you guys want to continue? Because honestly, I think the break is best to have right now.
I think it's best to continue.
Okay, we can
No,
continue.
no, let's have a break.
Okay, we'll have a break. Okay, we'll have a break. Meanwhile, in the break, I'm gonna be here. If you have any questions, anything you want me to repeat, it's okay. I can go back to first slide as well if you want me. So what do you think? Do you want me to repeat any concept, anything that's you're like only 5% doubtful about? I will repeat it. I don't care. It's fine. Just let me any concept. Let me know any concept that you don't get. I'm gonna repeat it. It's okay. So the silence tells me that you all either are not focusing or I'm actually an amazing tutor. So I hope it's the latter. Okay, so we'll start at 7:45. I gave 1 minute extra. I'm so generous, mashallah. You can pause the recording. I'll start. Oh, okay, thank you. Okay, so now the last, oh no, wait, not last. I got too excited, sorry. Okay, so now one of the last concepts in this lecture, okay, is the ligaments. Okay, now, before we get into each ligament and talking about each ligament specifically and all of that, okay, I want you to get one concept clear in your head. Okay. In each ligament, whenever we say the name of the ligament, we talk about the two bones that it connects. Okay, so for example, in this case, tibio-talar. Can someone guess what is it connecting?
The tibia and the talus.
Literally, that's yani. If you think about it, you don't need to memorize it. You can understand it and then memorize it. And it's gonna make it memorizing it much easier to you. Okay, so this is the medial side. How do you know it's the medial side? The tibia is on the medial side, okay? And the fibula is on the lateral side. Okay, I'm gonna tell you in the fibula slide, how do you know if it's fibula is on the lateral or the medial? And there is a mnemonic. Anyways, so the tibia is on the medial side, okay? So we're gonna have the medial ligament. So this large medial ligament is called the deltoid ligament. And I didn't show individual ligaments because I don't think you need to know each individual ligament. And you can probably guess them because from their names, okay? So the deltoid ligament is going to be divided into 4 ligaments. Okay, so what are these 4 ligaments? Okay, so each ligament is going to connect between the tibia and one of the tarsal bones. So it could be between the tibia and the talus, which is known as tibiotalar, sorry, tibiotalar. So we have posterior tibiotalar and anterior tibiotalar. So these are the first 2. Or it could be between the tibia and the calcaneus, yeah, okay, between the tibia and the calcaneus, okay, so tibiocalcaneal, or it could be between the tibia and navicular, which is known as tibionavicular, okay? So how do you remember which one is which and how do you remember them? It's simple. First of all, realize, are you in the medial side of the foot or the lateral side? If you're on the medial, it's the tibia, okay? If you're on the lateral, it's fibula. So if it's on the medial view, you're going to have tibia connected with the tarsal bones. So what do we mean by that? It means that tibia will be connected with the talus, for example, which is known as the tibio-talar joint. Okay. Or for example, you're going to have the tibia connected with the navicular, which is known as the tibio-navicular joint. Or you have the tibia connected with the calcaneus, which is known as the tibio-calcaneal joint. Okay. And you also have what's it called, anterior and posterior tibio-talar. Okay, so this is all collectively known as deltoid ligament. Why is it important to know that it's deltoid ligament and know these specific names? I'll tell you why. Some of you will just go through this slide and they'll be like deltoid ligament, medial side, khalas, and they move on. It's important to know the individual names because sometimes the question will come for someone basically have tear in the medial ligament. And we'll tell you which of the following is the ligament. They're not going to tell you the question like that, but we're going to get to that later. They're going to tell you which of the following is the ligament that's affected. They might bring you deltoid ligament, and this makes your life easy. Khalas, you remember a deltoid ligament on the medial side, and that's it. Okay. You might remember. You might look at the choices, and you will find that none of the choices is deltoid ligament. So, in this case, you would look for one of these 4, because if you have one of these 4, this is the answer straight up. And they're not going to bring these, more than one of these in the same answers. Okay, so if they bring you, for example, that the medial ligament is torn, it could be either deltoid ligament, or it could be posterior tibiotalar, or it could be tibiocalcaneal, or tibionavicular, or anterior tibiotalar. So remember these names, just in case deltoid ligament was none of the choices, it will be one of these. Does that make sense?
Yes.
Okay. So now we're going to move to the lateral side. Now, In the lateral side, we have the fibula. How do you remember the fibula is on the lateral side? I would say fibulateral. This is not even a word, but I just made it up. Okay, so fibulateral. So fibula is on the lateral side. Does that? I hope this mnemonic helps you. I don't know. Maybe it just makes sense in my head and I'm crazy or something. But I hope it does. So fibulateral. So remember, fibulateral means the fibula is on the lateral side. Okay. So the fibula, here's the fibula, is going to be connected to tarsal bones. What are these tarsal bones? It's going to be connected to the talus. Okay. And it's going to be connected to the calcaneus bone. Okay. So we're gonna have multiple ligaments. So we're gonna have the anterior talofibular and posterior talofibular. So it's connecting between the talus and the fibula, and it's anterior and posterior. And then we have the calcaneofibular. So it's connecting between the calcaneus and the fibula. Here you can see it. And this is between the posterior aspect and this is the anterior aspect. And it's very simple. There is no trick in it. Okay, just remember. And this collectively, these ligaments collectively, they're known as the lateral collateral. It rhymes, lateral collateral. خلاص. There is no difficulty in the name. Okay, lateral collateral. So for the lateral side, we have the lateral collateral. For the medial side, we have the deltoid ligament. And just remember the individual names. So we have 3 here and we have 4 there. I'll repeat it one more time, just so it sticks to your memory. Okay. On the medial side, we have the tibia and we have the deltoid ligament. What connects the tibia with the ligaments? So what are the ligaments? We have the tibio-talar, anterior and posterior. These are 2. We have tibio-calcanea and tibio-navicular. And then we have the fibula. You're going to have the same names, except you're not going to have navicular. So you're going to have anterior talofibular, posterior talofibular, and calcaneofibular. There's no navicular. So just 3. And this collectively is known as lateral collateral. Okay? Does that make sense?
Yes.
Okay. Does it? Is it hard for anyone? Did anyone not understand or?
No, it's clear.
Clear. Okay. So we can move on. Okay. So subtalar joint for which movements? I'm gonna keep asking this until you guys get bored of it.
Eversion and inversion.
Okay. Perfect. Okay. Now, lastly, we have on the posterior view just one ligament. This is the ligament that we care about, which is the inferior tibiofibular. So it's connecting between the tibia and the fibula. Add the names together. What are you going to get? Tibiofibular. Literally. Don't try to complicate complicate the lecture on yourself. خلاص. Tibia with the fibula. Tibia with the fibula. Tibiofibular. And it's inferior. Why is it inferior? Because if you think about it, the tibia is a long one, and there is in the knee joint, it's the the superior tibiofibular ligament. In the inferior or in the ankle joint, we're gonna have the inferior tibiofibular. So this is how we know it's inferior, because it's in the ankle joint, it's not in the knee joint. And how do we know it's tibiofibular? Because it's connecting them literally. Okay, so these are the what's it called? These are the ligaments. Okay, we can move on to the injuries. Or does anyone have anything unclear about the ligaments?
Do we have to memorize the ligament for OSP?
You definitely do. They're going to ask you, for example, they're going to bring this case, which is, we're going to talk about it in a bit. Or they might, you mean like the position itself or just the name?
The name.
The name. Okay. So let's say they tell you what's connecting, or for example, what are the ligaments in the ankle joint? How are you going to be able to answer? You have to know the name of these. Okay. So you would say, for example, on the medial side, you would have the deltoid ligament. On the lateral side, you would have the lateral collateral. Posteriorly, you would have the inferior tibiofibular. So this is one way the question could be asked. Or it could be asking, for example, someone who is having hyper-eversion or hyper-inversion. They're going to ask you which ligament is damaged. You're not going to be able to answer unless you memorize the name of the ligaments. I know it might be a little bit overwhelming, but inshallah you can do it. And you just try to repeat it twice or 3 times to yourself, and you're going to be able to memorize them, inshallah. Okay? Okay. So this is one of the most important concepts in this lecture, if not the most important concept in this lecture, which is the sprain of the ankle. And many of us probably already sprained their ankle, if not, alhamdulillah, and inshallah not in the future. Okay, so this is what's happening here is hyperinversion. Okay, and remember, The sole of the foot will be facing inward. Okay, so this is hyperinversion. Remember the concept I said in the first slide, when we have stretching of the ligament, this is when it gets torn. So in hyperinversion, okay, so this is the foot of someone. Okay, this is their feet. Hyperinversion, it's moving this way, moving this way. Okay, let me draw another. I don't know if you can make sense of this. Okay, which ligament is being stretched the most? The medial or the lateral? And I don't want you to say it because you memorized it. I want you to understand it. Which ligament is being stretched the most? The medial or the lateral?
Lateral.
Lateral. Okay, because we're moving. So this is so let's say this is the normal foot. Okay, so we have ligaments here. Okay, so this is the lateral side and this is the medial side. Okay, when we move the medial side, this is becoming loose. This one is becoming so stretched. Okay, so this ligaments. Okay, let me draw this for you guys. This ligament is becoming so stretched when you're moving, when you're hyperinverting. Okay, it's becoming so stretched. It's gonna keep stretching, and we're gonna have the lateral ligament. Lateral ligament will be torn. Okay, so in hyperinversion, sorry, which ligament will be what's it called? Which ligament will be torn or overstretched? I'd like to think of it overstretched, which means torn. Okay, because overstretching is going to tear it apart. Okay, which ligament will be overstretched or torn is the lateral ligament in hyperinversion. Okay, now this is important to understand. In the lateral ligament, what is it? It's called the lateral collateral ligament. So it could be either the posterior talofibular, or it could be the calcaneofibular, or it could be the anterior talofibular. Now, why did Dr. Atif specifically say that it's the anterior talofibular ligament that is torn? Because it's the most susceptible, and it's just, most patients, when they go to the clinic, it's mostly the anterior talofibular. There is no reason. You just have to remember that whenever someone has hyperinversion, and we have what? Just think, على طول, think anterior talofibular. Okay, so you think here, anterior talofibular. Okay, whenever you have hyperinversion, anterior talofibular is the answer. Okay, they're going to be like, which ligament is torn? Okay, so this is this paragraph. Now, I'm not sure if Dr. Atif covered this paragraph or not, but I could explain it to you, and it's very simple. So I'm going to explain to you, since we're here already. Okay. So now you need to understand, in the ankle, we have a socket. So this is the socket, okay? I don't know if you can see. And it's made from a medial ligament and the lateral, medial malleolus and lateral malleolus, okay? So this is the medial malleolus and lateral malleolus, okay? So this is the socket that's made, okay? This looks so weird. I don't know if you can see. If you can see, please let me know, because I don't know what I'm doing right now. I'll look. Okay, you can see, perfect. Okay, now this is talus. Okay, so what is wrong with talus is that talus is wider when it's wider in its anterior aspect, just like our hand. When you look at your hand, anteriorly, it's wider than posteriorly. See, this is anteriorly, it's wider. Just look at your hand. It's anteriorly wider than posteriorly, okay? Talus articulates with the malleolus, okay? So this is to form the ankle joint, okay? So let's say talus will, we have, for example, this is the normal, how joint is normally, okay? So this is how the joint is normally. Sorry, I'll do this so you can see it. Okay, so if we have dorsiflexion, what's gonna happen, you're gonna go to the wider end, okay? And once you go to the wider end, it's very stable because it's the wider, and it won't be any loose. It's gonna be stable because it's the wider end of the talus. When you go to the looser end, you're gonna have loose, the joint is gonna be loose. So when you have dorsiflexion, the joint is going to be so stable, but when you have plantar flexion, the joint will be loose. And this is exactly what's being said here, okay? So it's saying in dorsiflexion, we have the wider anterior version. Remember, the talus is anterior, wider, okay? The posterior is thinner, okay? And this means that it will firmly go into the socket, which is made from the malleolus, remember? Okay. However, the posterior aspect is going to be loose fit. Okay, so this is all you need to understand. Now, you might ask me, Wallah, who's going to walk like with the dorsiflexion? No one is going to walk with dorsiflexion. People will walk with plantar flexion. Where do we have people walking with plantar flexion? People who are wearing heels. Okay, so whenever someone is wearing heel, their foot is constantly in plantar flexion. And what did we say about plantar flexion? We said that plantar flexion is going to be in the loose end. So that means it's more susceptible to what? Yes, perfect. Who said ballet? Ballet is actually a really good answer because that's where we have a lot of ankle strain. Okay, so Can you repeat? Okay, so I'll repeat. Okay, so from the beginning. Okay, let's go from the beginning. This is the medial malleolus, and this is the lateral malleolus. Does that make sense? Okay, so this is it. It's like a socket. You see the socket that it's forming? Okay, this is the talus. Okay, wait, let me see the chat. Okay, yes, okay. This is the socket. Okay, medial malleolus, lateral malleolus. This is talus. Okay, talus anteriorly is wide. Posteriorly, it's thin. And this is how it is. Okay, think of it like your wrist. When you look down at your wrist, it's wider anteriorly and it's thinner posteriorly. Okay, why is this important? Because normally, when the joint is normal, talus will be like this. It's any middle, yani not too loose, not too tight. Okay, when we dorsiflex, what's going to happen is the whole joint is going to go up, and we're going to be at the firm end. Why? Because it's wider. It's going to be more fit into the socket. When you plantar flex, okay, like this, it's going to go to the looser end. It's going to be loose. Your foot is going to be loose. And why is this important? Because when your foot is loose in the socket, what's going to happen is that you're more likely to have hyperinversion or hypereversion. That's why if you see a case, yani if you see someone wearing heels, they're more likely to have hypereversion or inversion. Okay, this is important. Okay, because they might tell you, and wallah, someone just went to hyperinversion, and this happens, and even if you're not wearing any heels, okay? But if you see, someone, wallah, is wearing heel and he's having hyperinversion, why is he having more? Why is he more prone to injury? Because the joint is unstable. Why is it unstable? Because it's the loose end of the, it's the thinner end of the tibia, or the posterior aspect of the, not tibia, sorry, the posterior aspect of the talus. Okay, does that make sense? Or you want me to repeat again? It's fine, I could repeat. Okay, someone is saying yes. Alhamdulillah. Okay, perfect. So from this slide, what do we need to know? We need to know that hyperinversion equals what? Hyperinversion equals damage in the anterior talofibular ligament. Now, I don't want you to just memorize it robotically. I want you to understand it. Why do I want you to understand it? I want you to understand it so that if, for example, Dr. Atif might, for example, bring you, you have hyperinversion. Which ligament is affected? It could be lateral collateral, and that's still correct. You have to understand when you have hyperinversion, you're affecting the lateral collateral ligament, but specifically you're affecting the anterior talofibular. Okay, so if the question has answer lateral collateral, that's the answer. Or if it has anterior talofibular, that's also the answer. Okay, so now we can move on to hypereversion. Okay, okay. So in hypereversion, which ligament will you stretch out the most? Let me know, guys.
Medial deltoid.
Sorry?
Deltoid
medial.
ligament.
Perfect. Perfect. Yes, perfect. Medial or deltoid ligament. Okay. So deltoid ligament is made of 4 ligaments. If you see hypereversion, okay, and they will ask you, for example, which ligament is affected, it could be either deltoid or one of the 4 that are stated. Okay, don't panic if you don't see deltoid. It could be one of the 4 that are making it. Is either anterior tibiotalar or posterior tibiotalar, or it could be tibiocalcaneal or tibionavicular. Okay, one of these 4, or deltoid. If you have deltoid is the answer. It will be much easier for you. Okay, now what is this? What is Putz fracture? Okay, now in a lot of people who have hyperinversion, not only they will affect the deltoid ligament, but also they will have other things. Okay, so what are these things? They're summarized in 3 things. Okay, so first thing, we talked about it, we discussed it, is deltoid ligament is going to be torn. Okay, so I'm going to do this like this is torn. Okay, so the second thing, well, my pronunciation and spelling and everything. Okay, the second thing, we have these 2. So what are these? This is the medial malleolus and this is the lateral malleolus. So both the medial and lateral malleolus are going to be affected. Okay, now the last one makes sense. Okay, so what's connecting the tibia with the fibula?
Intraosseous membrane.
Intraosseous membrane is correct, but one of the ligaments that we talked about.
Tibiofibular ligament. Inferior
Yes.
tibiofibular.
Yes, inferior tibiofibular ligament. Now this is not true in real life, but what I would think of it is that the medial malleolus is going this way. The lateral malleolus is going this way. So the ligament is here. We're tearing it apart. So the third thing that would be affected is the inferior tibiofibular. Okay, so let's repeat it. In Pott's fraction, first of all, we have a fracture. First of all, we have hyper-eversion. Okay, so the first thing we have hyper-eversion. Hyper-eversion will lead to three things. The medial ligament or deltoid ligament is affected. If deltoid ligament or either four of the ligaments are mentioned that make it up, it's both are correct. Okay. طيب. And then the second thing, you're gonna have medial and lateral malleolus, okay, fractured. And the third thing, which is the inferior tibiofibular ligament affected. Okay, does that make sense? Or do you want me to repeat anything?
It makes sense.
Okay. If someone doesn't get it, it's okay. I could repeat.
What would the lateral malleolus do? If, like, why does it?
Why would it be affected?
Yeah.
How? Honestly, yani, if
Because
you
I
want me
think
to
he
give,
told us only medial malleolus.
honestly, no, it's both medial and lateral.
It's both.
Yeah. But honestly, yani, why? Okay, so look, in a clinical case, yani, you can either have this alone, either deltoid ligament affected, or it could be deltoid plus medial malleolus, or it could be deltoid plus medial plus lateral malleolus, or it could be deltoid plus medial plus lateral plus inferior tibiofibular. Yani, don't stick to your memory in wallah, it has to be all these three, okay? Just, yani, the question will be very simple, inshallah, but yani, it won't be complicated. But why is the lateral malleolus affected? I have no idea, honestly. Yeah, I'm just honest with you. I have no idea. You just have to yani, understand it. So just memorize. And no, medial lateral malleolus, okay, are affected. Deltoid ligament and inferior tibiofibular.
Okay. Thank you.
Okay, someone is asking me to repeat. Okay, no problem. Okay, so in hyper-eversion, okay, so we're stretching out. Wait, oh my God. Okay, so hyper-eversion, we're going, the foot is going this way. So this ligament is being stretched out so much. Okay, so look, it's getting so stretched. This one is, look, it's relaxed. Nothing is happening here, okay? This is the lateral. So the medial ligament is being so stretched. So the first thing that you're gonna see is that the medial ligament will be affected. Here, you can see it torn, okay? So this is the first finding, okay? So we have deltoid ligament torn, okay? That's the first thing. The second thing we're gonna have is that we're gonna have fracture of the medial and lateral malleolus. Okay, so that's the second thing we have. Why do we have that? Yani, honestly, I have no idea. Yani, it's just common presentation that we have in Pott's fracture. Yani, it's something that usually happens in Pott's fracture, okay? It doesn't have to be all of basically all of these findings. It just has to be a fracture plus the deltoid ligament affected, okay? And the third thing, the talus will be moving. Probably that's what the reason is behind it. But honestly, these details, you don't need to commit them to memory. You don't need to know anything about this. The clinical case will come and will tell you everything. You just have to choose the right answer. And no one is going to ask you why, unless you're very interested in knowing why. And it's okay. But the question will be easy for this, inshallah. And you're all going to get it right. I'm sure about this, inshallah. Okay. The third thing that will be affected is the inferior tibiofibular. Okay. So do you get it or no? It's okay. I could repeat again. Try to explain it. Mr. ... Okay, I'm happy you all got it, and I'm actually gonna test if you did. So, yeah, let's see. Let me know what's the answer.
Deltoid?
Deltoid, yes. Perfect. You guys are so smart, mashallah. I'm so happy you all are got it. Yeah, alhamdulillah, alhamdulillah. If there is one student that didn't get it right, I'll be really sad. And I'm here to explain it again before I move on. Please, let me know. It's okay. It took me a really long time when I was first here to get this concept. It's completely fine if you don't get it. Just let me know so I can explain it now. Okay, no one is speaking. Yani, alhamdulillah. Okay. Okay, so this is the explanation. I'll leave it for you guys to read in the slide. Okay, now this is the last concept. Whoa, finally. Okay, so what is this concept? Is that we have arches in the foot. Okay, so what does that mean? It means that literally, when you look at, like right now, if you look at your feet from the side, you're gonna see that there's a gap. Okay, so this gap represents this, an arch. Okay, so two things to take away from this slide. Okay, so this slide is just trying to say a lot of physics and stuff. Don't worry about it. It's okay. Just know that we have medial and lateral, longitudinal. Keep that in mind. Longitudinal to. Wow, my spelling is so off. بس يعني, you get the point. Arch. Okay, so we have medial and lateral longitudinal arch. Which one is more prominent? Literally, يعني, if you are stuck in the exam and you don't know which one is more prominent, just look at your foot. Place your foot on the ground. Medial, you can see everything and going, and there is an arch. Unless you're flat-footed, you're very unlucky in the exam, especially. The lateral, you're not gonna see anything, and you're barely gonna see a gap. The medial is a very obvious gap. Okay, so they might ask you which one is more gap. Okay, and they might ask you, what's it called? They might ask you which one is it longitudinal or medial? Because I remember, not medial, sorry, transverse. Because I remember in our exam, we got a question about whether the arch is longitudinal and transverse, and it was a very easy question, and I couldn't get it right because I never read the word longitudinal. So please, guys, remember that it's a longitudinal arch, okay? And it's both medial and lateral, but medial is the most important, not most, more important one, and it's more prominent, okay? Okay, someone is saying, does the deltoid ligament get damaged because of dislocation of the talus and calcaneus? I'm not sure about this, but it's not mentioned in the slide and probably doesn't mean any. It means that you shouldn't know this. But it would make sense, Yani. I like your thinking. It would make sense that it gets dislocated, but Yani, this is not something I'm not sure about. Make sure of it. And it's not something you should know, I think. Okay, so this is the concept you get from this slide. Okay, fine. So this is a very weird analogy, but the arch of the foot is like this, okay? And there's no arch in the world, that's held on its own. So we need things that will go and suspend it, either support it like this, or suspensions like these. These are all basically supportive system. Why do we need the supportive system? Because if this supportive system is not there, what's gonna happen is that we're gonna have flat foot, okay? Or the arch is not gonna work anymore, okay? So this slide, and honestly, I tried my hardest to find any way to explain it to you guys, and there is not much to explain. It's just you have to memorize this. So this is the medial side. How do you know it's the medial side? It's the tibia. Okay, remember fibrolateral. Okay, so the medial side of the foot. Okay, we have this arch, which is the more. Oh, sorry. This is the. Oh, wait, I need to get my pen again. Okay, the medial side had this arch, which is more prominent. Okay, so even look at the lateral, it's less prominent. The medial is way more prominent. Okay, we have arch support, okay, that will support the feet, okay, to keep this arch there. Okay, so what are these supports? Okay, so we have the spring ligament, short plantar ligament, long plantar ligament, plantar aponeurosis, plantar muscle, tibialis posterior tendon. Okay. You're going to tell me, what do I need to remember from this? You're going to have to remember these 6 names. I'm so sorry. I need to tell you this and break down the bad news to you, but you have to remember these. Is there any way to remember them? Honestly, the closest thing that I could remember, that I could create closest to a mnemonic is this. Sarah standing, why am I trying to be American? Sarah standing too long progresses painfully. Why does this make sense? Because in flat foot, when you stand for too long, it's going to be painful. So remember, this is what keeping Sarah from having a painful foot. So you're telling Sarah, no, Sarah standing too long progresses painfully. Just take each letter from the beginning, you're going to get this. This is a simple mnemonic. I don't know if it's going to make sense or not. Just it's my way of memorizing things. I like to make mnemonics. If it helps, it helps. If it doesn't help, it's completely fine. Okay. Anyways, so this is the medial side. You have to remember them. The plantar, the medial side, yeah, the lateral side, okay, it's the same thing, okay, except 2 things. So you're not gonna have a spring ligament, so spring ligament in the lateral side. Okay, so I'm gonna write this next to it, XL. So that means it's not on the lateral side, and you're not gonna have this muscle in the lateral side, obviously, because you have different muscle. So you're gonna have 2 additional muscles, peroneus longus and peroneus brevis. These are only in the lateral side. I wish there is a way to explain this, or there is a way to memorize it in a nice way, but you guys have to just know the names and memorize them. Honestly, I tried my best to give a mnemonic, but even the mnemonic, you have to get a mnemonic for the mnemonic, if you get me. But you just have to memorize the names, and inshallah, you're gonna remember them. They're gonna tell you, for example, I remember one of our OSPE questions, maybe our SAQ, I think OSPE. They tell you, for example, and mention 2 of the longitudinal arch support, and just mention 2 of them, for example, or 3 of them. Always remember, try to memorize as much as you can, so that if you forget some of them, you'll be able to answer the number they ask you for. Okay. What's the concept that you need to understand this? And here, just understand that whatever you're having here, these supports, whatever you have here, this is supporting the arch from falling down in the medial side. And whatever you're having here, this is supporting the arch from going down on the lateral side. Literally, that's all you need to understand.
Were they specific? Like, did they say like give us a longitudinal arch that supports the tie beam or the?
I don't. شوف. So if you want to really make sure that you get this question right, you have to you have to know these first of all. I'm not sure if you have to know this, but honestly, there's much more important things to focus on than knowing that it's plantar calcaneonavicular ligament or the tie beam. Tie beam thing, forget about it. He's not going to ask about this. Tie beam or suspensory, he's not going to ask about it. Or for example, all of this here, he's not going to ask about it. He might ask about the name of the ligament, which I very much doubt. It's not that high yield and it's not important. But if you want to, if you have extra time, go ahead. But if you don't, it's okay. Just know these, and inshallah, you're going to be good. Inshallah. I hope so. Okay. Any other questions, you guys? He mentions more dynamic support in his YouTube channel. I don't get it. Can you tell me? What do you mean?
I mean, for example, in the medial longitudinal arch, in his YouTube videos, he mentioned that flexor hallucis longus is a very important dynamic support, and it's not mentioned in his slides.
It's not mentioned in his slides?
No, and
probably.
so many
Yeah.
students from like past years said that he questions stuff that he says in his YouTube video, even if he didn't mention it in his slides.
Okay, so let me tell you this, and this is about general MSK, not just this lecture. Whatever Dr. Atif mentions in the lecture, or whatever is in the lecture, probably most of 98% of his questions will come from his slides. There will be this one question that will come out of his slide, and everyone in the batch will complain about. So even if previous batches will tell you, wallah, this question came from outside the lecture or from his video, it's gonna be like one question out of like 90 or 80 questions. So, and it's gonna be probably appealed, and it's going to be probably removed from the exam, so don't worry about it. Inshallah, it's going to be good. People are asking me to repeat. Okay, so let's repeat all the concepts. Okay, so when you look at the foot, you have an arch. So you have an arch like this, okay, and like this, okay. So this arch is a longitudinal arch. This is the concept I was trying to clarify. It's a longitudinal arch, okay, and we have one on the medial side and on the lateral side. Which one is the more important one, the medial or the lateral? It's the medial side. Here's a big M with 4 underlines. Okay, the medial side is more important, way more important than the lateral side. Okay, which bone? This is I didn't explain before. I don't think it's important, but if you're asked which bone is the keystone to the arch, is the talus. Why is it talus? Because it's like holding the bridge from falling apart. It's the bone that's shifting all the way toward this. You don't need to know this. This is physics. This has nothing to do with anything related to MSK. Okay, just understand that the keystone is talus. Memorize it. It's okay. But you have medial and lateral longitudinal arch. Okay, and we said the medial longitudinal arch is more important. Okay, and we said this is how the bridge is being supported and all of that. Okay, so what I said here, I said that we have 6 supporting structures, okay? Do we need to know all of them? Yes, you do need to know all of them. Do you have to memorize all of them? Yes, you have to memorize all of them. I'm so sorry about this, but you have to. And I said that the medial arch is the more important arch. Okay, fine. How are you going to be asked about this? The first way you're going to be asked, name 3 support. I guess you get the point. Supportive structures for the arch. You would say, for example, long plantar ligament, plantar aponeurosis, plantar muscle. Okay, why would I say these 3? Because these 3 are the same for both lateral and medial sides. And you just try these 3, memorize them very well, because if they ask you about lateral or medial, it's the same answer. Okay, they might ask you, for example, wallah, this is very it's a difficult question, but I'm sure you guys are going to be able to answer it if it comes. For example, they're going to be like short plantar ligament is affected. What's going to happen? You're going to be like the foot of the arch will be affected. Okay, so that's another question. Okay, the third question, for example, will be, I I think that's it. Yani, there's no other way they could ask you about this, honestly. Okay. So what is this mnemonic? It's just you're telling Sarah that she's standing for too long. For people who have flat foot, okay, if you're standing too long, what does it mean? It's gonna you're gonna have, what's it called? You're gonna have pain in your foot. Someone is asking, we can't just memorize 3. You could, but what if they ask you, for example, name 4? You're gonna be really annoyed that you didn't memorize an extra one, for example, you know. So yani, the least try to memorize 4. You could memorize all 6. That would be perfect. Do you have to commit it to memory and make sure you really remember it? Yani, it's fine. It's not that important of a concept, but probably a question will come about it. So if you don't have time and you have a lot of more important things like the muscles and the nerves and the blood supply to memorize, okay, sure, don't memorize all of them and don't spend like 3 hours just trying to memorize all of this. But if you have time, definitely go for it. Definitely, because a question might, not always comes, but might come, and it's an easy question. It's just memorization, pure memorization, and it's not going to be like, it's going to be straightforward, inshallah. Okay, and the same thing for the lateral side, except that we don't have these 2. Okay, so we don't have them in the lateral side. Okay, we have these 2 extra in the lateral side, the peroneus longus tendon and peroneus brevis. Okay, so this is the concept you need to understand from the foot arch. Okay, now this is the last concept in the lecture, okay, which is pes planus, which is like a very weird name. I don't know where they brought it from. Anyways, it means flat foot. Do you need to know this? Yes. he will definitely just bring this, and he won't even mention flat foot in between the brackets. So just memorize it in case, you know. So what is flat foot? Basically, medial, or one of the arches, most likely medial longitudinal arch of the foot is affected. Okay, so once it's affected, the arch, why does the foot, have you ever wondered why the footstep looks like this? Because the medial arch is keeping the foot from stepping down here. There is foot here. Okay, we have foot here, but the medial longitudinal arch is keeping the foot from stepping on the ground. Even if you look down, you're not even stepping in this area. Okay, so when we lose this arch, what's going to happen is that you're going to have flattened and everything is going to appear. Okay, what do you need to know from this slide? Literally, all you need to know from this slide is that the medial longitudinal arch is affected in this. Do you need to know the flexible flat foot, rigid flat foot, fat pad, all of that? I don't think so. It's never been asked for like 14 batches. I hope you're not the first to be asked about this, and I don't think he will ask about this. This is literally the only thing you need to know from this slide is that it's medial longitudinal arch that's affected, and it's called pes planus or flat foot. Do we have any question about anything at all, or this concept first of all? No questions so far. Okay. Everything is clear. I'm so happy everything is clear. Okay, so this is, okay, someone sent something. Okay, this is the end of the lecture. Oh, actually, wait, no, I spoiled. Okay, so there is actually a question before the end. Okay, so you guys want to answer this?
B.
B, okay. And I stress this enough, and this might come. Okay, just make sure you know this. Okay. And this is the explanation, and this is the end of the lecture. Okay, so thank you guys for attending. And just to make sure, okay, I didn't ignore your request. I made sure to record. I made a recording for what's it called? Recording for all anastomosis. I drew the anastomosis from scratch for all of you guys. I'm going to share the recording with you, inshallah. And I even have a PowerPoint with the recording. So even if you don't want to listen to the YouTube recording, you have it there. But I'm going to upload the YouTube in case you want to listen to it on double speed and to your own convenience. I didn't do the knee joint because it's covered in the clinical and I don't want to do overlap, صراحة. I understand you guys, you can stop the recording, by the way. خلاص, I'm done. I understand you guys have studied